Well, pnawn da, good afternoon, everyone. Welcome to the second Expanding Horizons session. It's great to see you, talented years 5 and 6 learners, back again to spark curiosity and build confidence in science, health and well-being. I'm Sue-Ann Richards from e-sgol, and joining me today again is lecturer Emma Hughes-Parry from Bangor University Medical School. Now then, we'll be doing the whole session through Menti again. So join using the QR code or through the website and enter the PIN. The joining information will be at the top of the screen if you haven't had time to join in yet. But Emma, I can see that a few people have joined already, nearly 80 of you. So welcome. Welcome, Emma, and thank you for joining us today.
Thank you very much.
We're going to talk about the brain and zombies today, aren't we, Emma?
Yes, we are. So as you might know, as you probably do know, we talked a little bit about it last week. The brain is is like the control center of the body, but it's divided into a number of different sections, and what scientists have learned, so we've learned a lot about the brain. We still don't know everything there is to know about the brain. There's still more to learn about how it works and why it behaves the way it does. But some of what we do know about the brain is that certain parts of it, although it does work like a network, an electrical network, all of the different areas of the brain talk to each other and communicate with each other. Certain parts of the brain are responsible or more responsible for different functions and tasks than other areas. So we're going to talk about a few of these different areas of the brain and the different things that they're responsible for. So we're obviously not going to be able to talk about all of them. We're just going to talk about a few because there's obviously the brain is responsible for an awful lot.
I think we'll start with, a little quick question to get everyone warmed up. What does the brain do? Controls breathing, controls digestion, memory, or everything? I put 10 seconds on the clock. I don't think you'll need any longer. Right then, let's see what the responses are.
Great. Yeah, so this was a little bit of a trick question, this one. And a lot of you have said everything, which is really quite true. The brain is involved in pretty much everything that goes on in our bodies. But that's not to say that the other answers are wrong. It is involved in controlling breathing and digestion, and obviously processing our memories. So yeah, well done.
Well done. Yeah, so everything. Not only those three things, there are much more.
So many more.
Right.
Okay, so first of all, we're going to chat about the cerebellum, which if you look at the very bottom of the picture of the brain on your screens, you can see this sort of wrinkled walnut type section of the brain. Well, this is the cerebellum, also known as the little brain. It's one of the oldest parts of the human brain. There before any of the other sections evolved rather, and it's responsible for a number of different things, including coordinating movements, making sure that we can balance, keeping control of our posture, so keeping us upright, keeping the body upright. It also helps us learn new motor skills, things like learning to ride a bike or playing an instrument, so things that require a lot of different coordinating movements.
Right, so movement is the key word I should think there, isn't it, Emma? Right then.
Movement, balance, yeah.
Right. First question on the cerebellum. What does the cerebellum do? If you've listened to Emma there. Keeps you steady, controls emotions, stores your memories. or controls movement. So there are two correct answers here.
Yeah.
Right, let's see.
Oh, fantastic. Yeah, so most people have gone for keeps you steady. Yeah, so making sure that we can balance, keeping us upright, and controlling our movement as well, coordinating movements. Yeah, well done.
Great start. Now then, what happens if the cerebellum was damaged? Would you make bad choices, feel angry, walk wobbly, or have difficulty in balancing?
Again, there's two correct ones here, and then two that are incorrect.
Let's have a look. Oh, clear winners, I think, there, Emma.
Absolutely, yes. So yeah, well done, everybody. You've gone for difficulty with balance and wobbly walking. Yes. So these would just be two examples there if there was some damage to the cerebellum. Well done.
So that was the cerebellum. We're going on now to frontal lobe.
Frontal lobe, yes. So in the brain, in the main bit of the brain that you can see in the picture, there are several lobes or sections, and the frontal lobe is, as you might imagine, at the front of the brain. And we have a right and a left frontal lobe, but the frontal lobe is responsible for what we call executive function tasks. So these are things that require a lot of planning, decision making, and problem solving. So you in school are using your frontal lobe an awful lot throughout the day. It also is involved in what voluntary movement. So voluntary movement are things like, oh, I'm thirsty, I'm going to go and grab my cup so that I can have a drink. It's also involved in producing speech. So the movements involved in producing speech, so moving the different, the tongue, the teeth, and the lips that are involved in producing speech, and also with regulating our emotions. So planning, decision making, and problem solving are a lot of the things that the frontal lobe is responsible for.
And does our pupils, are they using their frontal lobe now, do you think, with problem solving?
We'll soon see on the next screen.
Right, let's have a look then. What does the frontal lobe do? Keeps you steady, problem solve, stores memories, or decision making. Again, there are two correct answers here. And the responses are flying in.
Fantastic.
All right, let's see. Ooh.
Fantastic. Yes. So everybody's frontal lobe was doing a good job there. So yeah, so you were making decisions, you were trying to choose between the different options and problem solving. Well done. Those are the two of the main things that the frontal lobe is involved in.
Well done, right. What happens if the frontal lobe was damaged? Difficulty making decisions, difficulty smelling, wobbly walking, or difficulty organizing tasks? Two correct answers again here.
Ah, brilliant. Yeah. So damage to the frontal lobe was a result maybe in difficulty coordinating yourself to make decisions and also difficulty organizing tasks. So maybe getting things in the wrong order, getting yourself mixed up when trying to plan a task. Well done.
Right, so that was the frontal lobe. On to the another part of the brain.
So there are obviously more parts of the brain than this, but this is the last one that we're going to be talking about, the temporal lobe. And you have two temporal lobes. So you've got two hemispheres in the brain, left and right. So you have a left temporal lobe and a right temporal lobe. And it's in the side of the brain here and here. And what it's responsible is for processing what you hear, so auditory information, so all the sounds that are around you coming in from the world. Also, it's responsible for forming and retrieving memories. So everything that you do, everything that you learn in school, your temporal lobe is helping you remember all that information. And then when it comes to maybe you've got a test, your temporal lobe is helping you retrieve that information so that you can answer the questions in a test. And also, it's responsible for understanding spoken language, so the language that is said to you by your teacher, by me right now, by your parents when they're telling you to go and brush your teeth and go to bed. That is all being processed by your temporal lobe.
So if you were learning a new language, Emma, would it be the temporal lobe would be working on that?
So the temporal lobe would be heavily involved with understanding what is being said to you and helping you process that spoken language. Yeah.
Oh, interesting. Right then. What does the temporal lobe do? Difficulty walking, tasting food, processing memories, or understanding language? Have you been listening to what Emma's been saying?
Amazing. Everybody's been using their temporal lobes and listening. So your temporal lobe is involved with processing memories and understanding spoken language.
Well done. Right, what happens if the temporal lobe is damaged? Difficulty understanding language, difficulty forming memories, making bad choices, or difficulty seeing? There are two answers here again.
Great, fantastic. Yeah, so if there was damage to the temporal lobe, that would probably result in difficulty with understanding language, so not being able to understand what was being said to you, and also difficulty forming or retrieving memories. Well done. Okay, so it's time for you to be brain detectives now. And we're going to be thinking about or imagining that there is a zombie apocalypse. So a strange virus is spreading, turning people into slow-moving and forgetful zombies. But wait, they're not dangerous. They're just really confused. So I want you to imagine that you are now doctors at Z Hospital, and patients are going to be coming to see you complaining of symptoms that are caused by this new strange zombie virus. So it's up to you to figure out which parts of the brain the virus is attacking in each patient that comes to see you.
Right, we'll have a look at the first one.
Okay, so this is patient number 1. And he comes to you, he's staggering, he's feeling dizzy, he's complaining of balance issues, especially when they're walking. And they've recently begun to feel a little bit uncoordinated. So now they have to walk with their hands out in front of them to help them balance. Their speech also sounds a little bit slurred and slow, maybe almost like they're mumbling through a mouthful of gravel. So one thing I need to do before you try and answer this question, the next question is we want you to think about which part of the brain the zombie virus has attacked. But just to give you a quick reminder of the parts of the brain that we've talked about, we talked about the cerebellum, responsible for coordinating movement, balance, and posture, keeping the body upright. We also talked about the frontal lobe, so responsible for planning tasks and decision making and problem solving. And then we also talked about the temporal lobe, so processing the things that you hear, forming and retrieving memories, and understanding language. So that was just a really quick reminder of the 3 different areas that we've talked about. Which part of the brain do you think is affected in this case? So he's staggering, he's feeling dizzy, and maybe falling over. Okay.
They are new names for me as well, Emma. So it's good to have that recap.
Cerebellum, frontal lobe, temporal lobe.
We'll have a minute on the clock, and I know it says for you to write your questions, but you write your answers. Well, the responses have been fantastic. We've had a few frontal lobe,
Okay.
Emma, but the main one has been the cerebellum.
Yeah, fantastic. So the cerebellum is responsible for coordinating your movement and your balance and your posture. The frontal lobe, we did say that the zombie was, they sounded like they were mumbling and the speech wasn't very clear. And like I said earlier, the frontal lobe is involved in speech production, so the muscles involved in speech production and the coordination of that. So yeah, well done, everybody. Okay, you get another patient now, and this patient comes to you complaining of memory problems. He can't remember words and he can't even remember his own name. When he tries to talk to you, all that comes out is grunts and ugh. He's had to have somebody take care of him because he just can't be trusted by himself. And the person that's taking care of him says he doesn't seem to understand simple instructions anymore. So, as his doctor, you're trying to assess him. You tell him to raise his arm, and he just stares blankly at you. He doesn't understand. He can't follow conversations, and he doesn't even recognize familiar songs, even though he used to hum along to them all the time. So, which parts of the brain do you think was affected here? Just a quick reminder, we've got cerebellum, frontal lobe, and temporal lobe that we have been chatting about so far.
We've had so many responses there, Emma. We've had a bit of a mixture of frontal lobe and temporal lobe.
Okay, yeah. So the temporal lobe is absolutely affected here because we're talking about memory problems and that they can't understand what is being said to them. However, we also did say again that they're mumbling and blah, 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 they're not sounding at all clear when they're speaking. So maybe the virus has also spread to the frontal lobe as well and is affecting their speech production. But yeah, definitely temporal lobe here is being affected. Well done.
Mm. Right then, we're turning to the doctors in training now.
Okay. Yeah, so we know that zombie viruses aren't real, they're just in films. But sometimes things can go wrong in the brain. Certain parts of the brain can be affected by certain things, and people are affected by things going wrong in the brain. So, why do you think it's important that doctors know exactly where a problem is in the brain? And so there's probably two more correct answers here and two answers that are maybe less correct.
Right then, let's have a look.
Okay, great. So most of you have said so they can fix the right part and not make the problem worse. That's definitely true. So if we know what somebody's symptoms mean, so what if somebody's symptoms mean that a certain part of the brain is affected, the doctor needs to fix the right part and not a wrong part of the brain. Very good. And also, um, if doctors know what the symptoms are, that can tell them where in the brain is affected, and that helps us know, different parts of the brain do different jobs. A lot of you have said because the brain can grow back damaged parts if the doctor removes them. Sadly, that's not true, unfortunately. Our brain cells don't grow back if they've been damaged, but don't worry, we've got millions of them, so plenty to be going around. And then so they can tell if the person needs glasses was the other one that was maybe a little bit less correct. So yeah, most of you went for the two correct answers, so well done there. Fantastic. Okay, so your final challenge is to think of an illness in the brain that can affect people as they age. So we've talked a little bit about mainly 3 areas in the brain. Obviously, there are a lot more areas in the brain, and there are a lot more jobs that the brain does as well. So not just things like memory, speech, and balance. And there are a lot of things that the brain is responsible for. So if you just have a think for a minute or so of an illness, or more than one if you can think of one, that affects people, that affects the brain in people as they age.
All right, time is up. And
Okay.
we've had a lot of responses, Emma, and I don't think I can go through them all, but I'll pick a few here. So dementia was mentioned a few times.
Yeah, so that's a big one, isn't it? So that's one that affects people as they get older. It mainly affects people's memories. So somebody with dementia might have difficulty remembering what they did yesterday, what they had for lunch. They also might have difficulty remembering people's names, and that kind of thing. So yeah, that's a big one, definitely. Well done.
Alzheimer's was another one.
Yeah, so Alzheimer's again, so Alzheimer's is actually a type of dementia, and again, really affecting people's memories an awful lot. So yeah, well done.
We've had a few, cancer and brain cancer.
Yeah, so that's a
Yeah.
really interesting one. Um, so tumors and cancers can grow in the brain, and then surgeons can operate on people in some cases, and remove the tumor. So obviously, in the case of a brain cancer or brain tumor, the symptoms would be really different depending on the part of the brain that it's in. So, if, for example, if it was in or near the cerebellum, they might have problems with their balance or coordination, or if it was in the frontal lobe, they might have difficulty with problem solving and so on and so on. So, yeah, so an interesting one there.
Well done. Another one we've had a few times is memory loss.
Yeah, so memory loss, even if people haven't got dementia or Alzheimer's, maybe as people get a little bit older, they start to sort of forget words or forget the names for things. And that's, perfectly normal as people get older, they start to maybe forget words here and there. So yeah.
Well done. I'm still going through them.
Yeah, you. Another big one is, I don't
Fantastic.
know if anybody's come up with stroke. That's another one that can
No, I
affect
don't.
people.
Yeah.
So a stroke is a little bit like a heart attack, but it happens in the brain. And again, the symptoms would be different depending on where in the brain it happens. So sometimes after a stroke, a lot of people have difficulty with speech and language, or sometimes they'll have balance problems, or sometimes again they'll have memory problems. But yeah, it just depends where in the brain that it happens.
Well, thank you, Emma, and thank you all for joining in and giving us so many answers that I couldn't only choose a few. Well done, you all. And that's it. Thank you very much, Emma, for guiding us through another interesting Expanding Horizons session on the brain and some zombies thrown in. Diolch yn
Thank
fawr, Emma.
you.
Thank
Thank you,
you all for
everybody.
joining. Yeah, and we'll see you next week. Diolch yn fawr pawb. Hwyl.